You can take calcium, you can take vitamin D, you can even walk every day. But if you miss two tiny movements that most women are never taught, your legs may still feel shaky as the years go by. And the hardest part is this. You might not notice it at first, until one day you slow down on the stairs, until you reach for the railing more often, until getting up at night to use the bathroom feels a little scary. What most women over 60 truly want is not stronger bones on a label. It is confidence. Confidence to walk without thinking about every step. Confidence to go down the stairs without fear. Confidence to move through your home at night without holding the wall. That quiet confidence is what keeps you independent. And once it fades, fear often takes its place. Here is the good news. Stability does not come from pills alone. It comes from teaching your body how to stay steady again. In this video, I will show you two simple home movements that support balance and leg strength. No equipment, no gym, no impact on your joints. I will start with the easier one first. Almost every woman can do it safely, even on a low-energy day. Then I will show you the second movement that many people overlook but need the most. Before we finish, I will also explain 3 common exercises many seniors still do that can quietly make balance worse, and what to do instead. Physical therapists often begin with hip stability and ankle strength because that is where steadiness starts. Stay with me. This takes less than a minute. In 30 seconds, I will help you test your balance at home. You are not alone. Many women over 60 tell me the hardest part is not pain. It is uncertainty. Not knowing when your body will feel steady and when it might not. Not knowing if today will be a good day or a careful day. Maybe you pause at the top of a small step before going down. Maybe you feel your legs shake a little when you carry groceries from the car. At night, you might reach for the wall on the way to the bathroom, even though you never used to. These moments seem small, but they stay in your mind. And with time, they can turn into fear. For many women, the fear is not just about falling. It is about what a fall could take away. Your freedom, your confidence, your ability to live on your own terms. The truth is, you did nothing wrong. We were taught to focus on bones. But balance is a skill too. And skills can be practiced. Have you caught yourself holding the railing more than before? Even when no one is watching. That is your body asking for support, not weakness. Everything today is low impact and gentle on your joints. If you have knee or hip issues, I will share simple safety checks along the way. Let us start by seeing where your foundation is today. As we get older, many women slowly lose steadiness for a simple reason. The small muscles that keep the hips stable and the ankles strong are used less. When those muscles weaken, each step feels less certain. Walking becomes cautious. Balance feels fragile. And the risk of a small trip turning into a fall goes up. Before we jump into the exercises, there is something important I want you to do. Let us take 30 seconds to see where your body is right now. This is not a test to judge you. It is a map to guide you. Before the exercises, let's do a 30-second check. Not to judge you, just to guide you. If this simple check feels harder than you expected, these 2 gentle movements are exactly what your body needs. Now let us do a simple 30-second check you can do safely at home. Please stand near a chair or a sturdy table. If someone is nearby, let them know what you are doing. This is about safety first, always. Place the chair behind you. Slowly sit down and stand back up 5 times. Move at a calm pace. Do not rush. As you do this, notice what your body is telling you. Do your legs feel steady or do they shake? Do you lean to one side? Do you need to use your hands to push off the chair? If sitting and standing feels uncomfortable today, you can try another option. Stand next to the chair and lightly hold it with one hand. Lift one foot and stand on the other leg for 10 seconds with your eyes open. Then switch sides. Again, just notice. Do you wobble? Do you tighten your shoulders? Do you feel unsure? This is information, not a score. There is no good or bad result here. This check simply shows us where your foundation is today. Now we will train the 2 exact weak links this check often reveals. After the second exercise, we will repeat this check and you will feel the difference. This first move wakes up your hip stabilizers, the muscles that control your side-to-side balance. These muscles help you feel steady when you walk, turn, or step over small obstacles at home. When they are awake and working, your body feels more secure. When they are weak, every step can feel uncertain. The hip abductors sit on the outer part of your hips. Their job is to keep your pelvis level. They help you stay upright when you step off a curb, turn in the kitchen, or go up and down stairs. As women get older, these muscles often weaken quietly. You may not feel pain, but you may notice wobbling, leaning, or the need to grab nearby furniture. Strengthening these muscles helps your body trust itself again. Many physical therapy programs use hip abductor strengthening to support balance and walking. These movements are gentle, low impact, and joint-friendly. They are often used to reduce fall risk and improve confidence during daily movement. This is not about pushing hard, it is about teaching the right muscles to work again. To do lateral leg lifts, stand next to a chair or countertop. Lightly place one hand on it for balance, not for support. Stand tall and relax your shoulders. Gently tighten your stomach as if you are zipping up a jacket halfway. Shift your weight onto your left leg. Slowly lift your right leg out to the side. Keep your toes facing forward. Do not kick and do not swing. Imagine you are moving through thick air. Lift only as high as feels comfortable. Pause for one calm moment at the top. Then slowly lower your leg back down, like you are placing your foot into a bowl of water without making a splash. That slow lowering is where the strength builds. Repeat this movement 8 to 12 times on one side. Then switch legs. Do 2 to 3 sets on each side. Rest for about 1 minute between sets. You can do this exercise 3 days a week, such as Monday, Wednesday, and Friday, or every other day if that feels better. Consistency matters more than speed. As you move, keep your toes pointing forward. Imagine your hips are headlights shining straight ahead. Try not to let one hip drop or twist. Small and controlled movements work best. If you feel sharp pain in your hip or knee, make the movement smaller or stop and rest. If the pain continues, it is wise to talk with your doctor or a physical therapist. If you feel dizzy at any time, sit down and take a few deep breaths. Drink some water and only continue when you feel steady. This is a powerful start, but it is not the full foundation. One important muscle group is still missing, and many people overlook it. In a minute, I will tell you about the common exercise that can undo this progress if you are not careful. One woman I worked with told me she used to feel confident on the stairs in her home. Her name is Linda. She is 68. Over time, she noticed something small but troubling. Each step down felt uncertain. Her hand reached for the railing every time, even when no one was watching. She felt embarrassed by how careful she had become. She worried that one wrong step could change her life. Linda did not feel much pain. That is what confused her. She simply felt unsteady. After learning the lateral leg lift, she began practicing it 3 days a week, slowly and with control. The first few sessions felt awkward, but after about 2 weeks, she noticed a change. The stairs felt calmer. Her legs felt more connected. She told me she still used the railing, but she no longer depended on it. The wobble was fading, and with it, some of her fear. Her confidence began to return, quietly and naturally. This move strengthens the ankle breaks that keep you steady. Your calves and ankles help control balance every time you take a step. They help you stop yourself when you slip a little. They help you adjust when the ground is uneven. When these muscles are strong, your body reacts faster and feels safer. For many women over 60, calf and ankle strength slowly fades. This can make walking feel cautious. It can make stairs feel harder, and it can increase fear of falling, especially for women with bone loss or joint stiffness. Strong calves help support the ankles and improve blood flow in the lower legs. They also help protect the knees by reducing strain during daily movement. Calf strengthening is often part of fall prevention programs. Physical therapists use it because it targets the small stabilizing muscles that help keep you upright. These muscles do not need heavy weight. They need slow, steady practice. To do toe-calf raises, stand tall with your feet about hip-width apart. Lightly hold a chair or countertop in front of you. Relax your shoulders and keep your chest open. Take a calm breath. Slowly rise up onto the balls of your feet. Count 2 seconds as you lift. Pause at the top for 1 second. Then slowly lower your heels back down, counting 3 seconds. That slow lowering is the most important part. It teaches your ankles and calves to control movement. Repeat this 10 to 15 times. Rest for about 1 minute. Do 2 to 3 sets. You can practice this 3 to 4 days per week, with a rest day in between if needed. Quality matters more than speed. Slow and controlled movements build real strength. If you have knee pain, you can reduce how high you lift your heels. Even a small lift is helpful. If you have ankle pain or feel unsteady, you can do this exercise while seated. Sit tall in a chair. Place your feet flat on the floor. Slowly lift your heels while keeping your toes down. Then lower them back to the floor. This seated version still strengthens your calves in a safe way. If balance is your biggest concern, use both hands on a table or counter while you practice. Safety always comes first. As you grow stronger, you may find you need less support over time. You can also turn this exercise into a daily habit. While brushing your teeth, do 8 slow calf raises. While waiting for the kettle or microwave, do 10 gentle raises. These small moments add up and help your muscles stay active throughout the day. If you feel sharp pain, stop and rest. Mild muscle fatigue is normal, but pain is not. Sit down, breathe, and drink some water if you feel lightheaded. Now you have hip stability and ankle strength working together. Next, let us make this stick with a simple 7-day plan and a realistic timeline you can trust. In 7 days, you should feel one clear change, and I will tell you exactly what to look for. It is important to set expectations that feel real and kind to your body. Stronger balance does not happen overnight, but it does happen when you stay consistent. Here is what many women notice when they practice these two movements regularly. After 7 days, most women begin to feel steadier. You may notice you do not reach for the railing as often. Standing up from a chair feels a little more controlled. Your steps feel calmer. After 2 to 4 weeks, daily tasks often feel easier. Carrying groceries feels less tiring. Standing at the kitchen counter feels more comfortable. You may feel more confident moving around your home. After 6 to 8 weeks, stairs usually feel less intimidating. Walking speed often improves. Your body reacts faster when you step on uneven ground. These changes build slowly, but they are meaningful. To get there, keep the plan simple. On days 1 and 2, do 2 sets of each exercise. Move slowly and focus on control. On days 3 and 4, increase to 3 sets if your body feels okay. On days 5 through 7, keep the same number of sets and pay close attention to the slow lowering part of each movement. Each evening, take a quiet moment to check in with yourself. Ask one simple question. Today, did I feel steadier on the stairs or when walking around my home? This small habit helps you notice progress you might otherwise miss. Now that you know what to do, let us protect your progress by avoiding 3 common mistakes many seniors still make. Before we finish, let us talk about 3 common exercises that may look healthy, but can be high risk for many seniors, especially when done alone or without guidance. These exercises are not bad for everyone, but for aging joints, they often add stress where the body needs support. The first exercise to be cautious with is weighted squats. When extra weight is added, strong pressure goes through the knees, hips, and spine. If form is not perfect, that pressure increases even more. Many women over 60 already have knee pain, bone loss, or a history of back discomfort. For them, weighted squats can irritate joints and increase pain instead of building strength. A safer option is chair sit to stand movements. You can also try small squats supported by a wall. These options train the same muscles with much less joint stress. The second exercise to be cautious with is heavy deadlifts. Lifting weight from the floor places a large load on the lower back and spinal discs. This can be risky for women with back pain, weak core muscles, or past disc issues. Even small mistakes in form can strain the spine. Safer alternatives include hip hinge movements without weight, gentle glute bridges on the floor, or exercises guided by a physical therapist who understands your body. The third exercise is running, especially if you are starting later in life. Running creates repeated impact with every step. That impact travels through the ankles, knees, hips, and spine. For many women over 60, this can trigger joint inflammation and discomfort. Walking is often a better choice. Brisk walking builds strength without harsh impact. Incline walking and short walking intervals can also improve fitness while staying joint-friendly. No matter what exercise you choose, pay attention to safety signals. Stop and talk with your doctor or physical therapist if you feel sharp pain, warmth or swelling in a joint, numbness that spreads, ongoing dizziness, chest pain, or unusual shortness of breath. These are signs your body needs care, not pushing. Another woman shared a very different story. Her name is Maria. She is 72. Maria started running because she wanted to stay in shape and keep her weight down. She had never been a runner before, but she pushed herself anyway. After a few months, her knees began to ache. Then the pain became sharp. Walking started to feel stressful instead of freeing. Maria stopped running and shifted her focus. She replaced running with brisk walking and short walking intervals. She added the 2 simple exercises you just learned. Within a few weeks, her knee pain eased. She told me she felt more stable and less tense when she walked. The pressure was gone, and movement felt friendly again. Her body responded once she gave it the kind of support it truly needed. So here is the simple formula. Train the right links, avoid the wrong stress, and stay consistent. In a moment, we will repeat that 30-second check so you can feel what has changed. Before we close, I want you to come back to that simple check you did earlier. Try the same 30-second check again tomorrow morning. Stand near your chair, sit and stand calmly, or balance on one leg with your hand nearby. Notice what feels different. Even small changes matter. This is how you learn to trust your body again. Let us keep this simple. There are 3 things that support steadiness as we age. First is hip stability. Lateral leg lifts help your hips stay level so each step feels controlled. Second is ankle and calf strength. Calf raises support balance, circulation, and quick reactions when you move. Third is avoiding stress that aging joints may not tolerate well. Being careful with high impact or heavy loading helps protect what you are building. You deserve to feel safe in your own body. You deserve to walk through your home without fear, to go down the stairs without holding your breath, to carry groceries, visit friends, travel, and enjoy time with your grandchildren without worrying about every step. Independence is not about pushing harder. It is about building the right foundation. Remember this: move smarter, stay steadier. Consistency beats intensity. Gentle movements done regularly can support balance and confidence over time. These exercises may help your body feel more connected and secure, but everyone is different. If you have ongoing pain, a medical condition, or concerns about exercise, it is always wise to talk with your doctor or a physical therapist who knows your history. There is no need to rush. There is no finish line to cross. You are simply teaching your body how to support you better, one calm step at a time. Be patient with yourself. Celebrate small wins. Each steady step forward is progress. If you are starting this 7-day plan, I would love to hear from you. Type the word steady in the comments and let this be a quiet promise you make to yourself. Or tell me which movement felt harder today. Was it the hip lift or the calf raise? Your answer may help another woman feel less alone. If this video helped you feel calmer or more hopeful about your body, consider subscribing. Each week, I share gentle senior wellness routines designed to support balance, confidence, and healthy aging at home. Nothing extreme, nothing rushed. Just simple guidance you can trust. In the next video, I will share one small bedtime habit that may help improve balance at night. It is something many women overlook, and it can make nighttime trips to the bathroom feel safer. I will also be sharing simple walking intervals made for women over 60, and later, 3 foods that can support muscle recovery as we age. You are not behind. You are not late. You are building a stronger foundation right now, one calm step at a time.